We're joined here at St George's Hospital by Dr. Borka Ceranic. So thank you so much for joining us. We're here because you're one of the head doctors at the hearing facilities here at
We have a department of audiovisual medicine along with ENT department. I must say that patients and doctors often mix up our department, but we are very distinctive departments, ENT and audiovisual medicine. Within audiovisual medicine, we have different type of clinics. For example, I run Dizzy Clinic, General Audiology Clinic, but what is of your interest is tinnitus and hyperacusis.
Yes.
It's a specialized clinic.
Yeah. So the ENT, what does that stand for?
Ear, nose and throat. Although I'm specialist, I have all the specialty in ENT, but I have another specialty in audiovisual medicine, which is my current job, audiovisual medicine.
One of the things that I've been affected is my hearing. Acoustic
Hyperacusis. This is condition which means increased sensitivity to sound.
Yeah. So how is it that it affects the ears?
We have to remember, I don't know how general audience is aware, hearing is not only ears. Hearing is a receptor system within the inner ear, then connections from hearing nerve to different stations within the brain and many nerves connected up to the top of the brain. So there are many sites, many levels within the hearing system which can be affected by injury or by tumor or by surgery. Although every surgeon takes every precaution to preserve hearing, but of course in attempt to be sufficiently radical to prevent recurrence of tumor, regrowth of tumor, has to be sufficiently radical, and sometimes that would lead in damage to the hearing pathway.
Yeah. I mean, what would it be, what is it someone would notice that there is something wrong with their hearing?
There are different problems which can be related to brain tumor or surgery. It may be hearing loss, which becomes very apparent because individuals can notice that cannot follow conversation. But hearing system can be unaffected. Depends which part of the hearing system is affected. Depends what symptoms patient will experience. If the surgery or tumor or injury affects the ascending pathway which transmits the signal from the ear to the brain, that person will probably have hearing loss, which is detectable and very apparent. But there is another pathway from the brain which goes down to the hearing, peripheral organ of hearing. And if this pathway is affected, and the role of this pathway is to modulate hearing, that may cause different problems, for example, hyperacusis. Because the brain has a suppressive effect to the ears, and if this pathway is affected, then this would lead to increased sensitivity to noise. So in addition to hearing loss, patient may have tinnitus and hyperacusis, which means increased sensitivity to sound.
What's the difference in terms of, what is the difference between tinnitus and hyperacusis?
Hyperacusis. Tinnitus is perception of sound.
Yeah.
And hyperacusis means increased sensitivity to sound. These two can often be together. One can have perception of sound in the absence of any other external noises, that is tinnitus. But at the same time can be aware of increased sensitivity, intolerance to different noises, environmental sound, sometimes to the degree that they cannot even put glass on the table without being disturbed. So it can be various degree of severity of hyperacusis. There is something common with tinnitus and hyperacusis, is increased sensitivity of the brain in the pathways, in the neural pathways of hearing system. Tinnitus means there is increased activity within the brain which leads to perception of sound. But overall, gain increase within the hearing system means increased sensitivity. While hyperacusis is usually in individuals who have clinically normal hearing, so when they go to see the doctors and they have hearing test, standard audiogram, they may have normal hearing thresholds, like in your case. But in tinnitus, there may be normal hearing, but maybe also it's actually quite more common in hearing loss. So tinnitus is a result of increased sensitivity, increased activity within the brain as a result of changes in the system, which then create this excessive noise. So that is the difference between tinnitus and hyperacusis.
Some people have said to me they've lost hearing altogether on one side. I'm guessing, I know that when we have the tumours removed and things, is that ever something that will come back? Is that something that it's gone? Is it very different for everyone?
I think the damage to the hearing system is usually permanent.
Yeah.
Sometimes during the surgery there may be some swelling of the brain and there is possibility of partial recovery of the brain. But if after some, maybe couple of weeks, everything settles down after the surgery, hearing loss would stay permanent because hearing pathway would not regenerate.
So there's no fix, there's no way of fixing it?
It is permanent. And this can cause, if somebody has permanent damage to the hearing system, then this would create excessive activity of the brain as in response to compensatory mechanisms to increase. So it is sometimes patient ask me, I have no hearing. Why should I have tinnitus? Because people forget that there is a neural pathway within the brain. So when they lose hearing, they get very, very often tinnitus. But when we restore hearing, tinnitus settles down.
Yeah.
And we have this very frequently, we see this in cochlear implant patients who have tinnitus, and almost regularly tinnitus disappears after cochlear implant. Because to restore sound, this is a treatment.
And they look the same as having the hearing aids? They're the same sort of things that everyone's using for these, or are they slightly different?
They look the same.
Yeah.
External appearance is similar because it is the shape of the sound process of the cochlear implant, but it's completely different.
Yeah, on the inside,
yes, because conventional hearing aids are so-called acoustic hearing aids, which are applied just to amplify the hearing, while a cochlear implant is devised to implant surgically electrode to the inner ear, which then replaces the damaged hearing cells and then stimulate hearing nerve and upper pathway, and that restores signal to the brain.
Yeah. So if people, for the people that they're not going to be able to, there won't be something that can necessarily help in terms of fix it. I know that you do the cognitive therapy and obviously you use the Apple devices.
Yes. First, when we see the patient, the first thing we have to assess the patient to see what is damaged. There is a hearing loss. If there is normal hearing, but tinnitus and hyperacusis, so then we have different strategy and different rationale, because part of the treatment is to explain the patient what is actually mechanism of tinnitus and hyperacusis, and we will not know this unless we do assessment. So this is part of the treatment to reassure the patient, because once you know what is the cause of your tinnitus and hyperacusis, you can deal much better with that. And also, by assessing the patient, we can dispel any fears associated with tinnitus and hyperacusis, that there is nothing behind that, nothing wrong, but it is part of the dynamic of the auditory system to respond in a way to injury. So if somebody has hearing loss, first thing we do is to advise hearing aid to restore input. And this will bring adjustment within the hearing system, because brain needs sound. Once brain receives sound, if it's previously there is a deficit in the hearing previously, then with new sound, restored sounds, that improves function of the hearing system. If person doesn't have hearing loss, we have some other tests which will indicate what is the state of the hearing system. We have a test which is called autoacoustic emission tests, which give us information about state of the hearing cells of the inner ear. And this test give us information about structural integrity of the inner ear, but also give us the way of insight how they function, because they're controlled by the brain. If the brain is damaged in the way that this descending pathway is affected, which modulate hearing, then we may have increased gain, increased activity of the inner ear, and we can see this from the hearing test, from the autoacoustic emission test. So we can have typically in individuals who don't have hearing loss, they may have very high level of autoacoustic emission, which reflect increased sensitivity of the inner ear, and then this reflects in the entire hearing system. We have also another test which we can do to identify if the pathway from the brain down to the ear is damaged. It is so-called olivocochlear suppression test. Because this is olivocochlear, means olivo is part, olivo system is part of the brain where the system originates, and cochlea is the inner ear. So olivocochlear means the pathway from the brain to the cochlea, to the inner ear. And we have the way of doing this because of the complex pathway of the hearing system. When we apply sound to one side, this signal goes to the opposite side and suppresses the opposite ear. So we can assess how much this system is affected if there is a disruption. We had a study in patients with multiple sclerosis, which typically affects the midbrain and this part of the system which modulates hearing system, which often present with tinnitus and hyperacusis. So this is the couple of tests which we have available. Then we can define auditory system and have some insight into the mechanism of tinnitus. So once we describe the patient, explain to the patient about state of their hearing, then we advise treatment. So if there is a hearing loss, we advise hearing aids. If there is no hearing loss, we advise hearing therapy. Hearing therapy is the treatment option for different hearing disorders, from simple hearing loss without tinnitus and any other symptoms, to other symptoms like a tinnitus, hyperacusis. Involves different type of counseling, reassurance, then this is directive counseling when we explain the patient what is the mechanism of tinnitus, what is the cause of tinnitus. Then we have every person who is have some specific characteristic like anxiety, depression. So they are different because tinnitus often is associated with anxiety, depression because it is a nuisance. So we have to also deal with this aspect to find a way of reassuring patient and advise some relaxation technique. And also to, as I mentioned earlier, to separate this fear of tinnitus as something, because some people believe that tinnitus is damaging hearing, which is nothing to do with that. It's just associated symptoms. Hyperacusis and tinnitus are only associated, and they don't affect hearing at all. So then we use sound treatment. It's also part of the hearing therapy, and we use different devices. They are often known masking, tinnitus masker, but it is really not aimed to mask tinnitus. We call them low noise generators because the purpose is not to mask, it's just to introduce another sound, which is competing sound to tinnitus. And it is not necessarily to mask, which is aimed, because temporary relief is obviously present, but in long term, the repetitive application of low noise promotes adaptive mechanism, and then gradually leads to reduction of perception of tinnitus. But it is quite long process. It requires at least 6 to 8 hours wearing device, and sometimes take about 1 or 2 years to achieve effect.
I think something I've found is that while I've had to try one as well with the device, is that the itching.
Sometimes we can use hypoallergic molds because there are different devices, because some people are allergic. So if they tell us, they're hypoallergenic.
And I know you can use different devices in terms of the tubes that they have. Is you can get smaller and
it's like a little tip, plastic tip.
So you can you can get smaller,
so
larger.
This is just technically the way to apply
to try and make
sound.
it comfortable for people.
These are low noise generators, which are mainly for tinnitus. But we also use low node generations for hyperacusis, but in different ways. For hyperacusis, we call this process desensitization, because we gradually increase the level of sound which a person can tolerate in order to increase tolerance and reduce this perception of increased sensitivity.
I think at first what I found is you don't notice any difference, but it was, I think yourself, you said it when I first met you, that sometimes people don't realise it's better until someone else says to you, you're still sitting in the room still, you haven't left a crowded room.
Yes.
You've coped with it more than you were saying that you won't always notice it, but someone else may notice it.
Yes.
That you're still there.
Because that is the brain. Brain is not set in stone. Brain is dynamic and brain adjusts. So it is, for example, if somebody has hearing loss on one side, that increases sensitivity of the other side. Sometimes people actually develop tinnitus and hyperacusis in the good ear because of the, again, lack of interaction between the ears and increased activity of the other side. And sometimes this can be quite concerning to the patient because they think something is going wrong with that ear, but it's actually increased sensitivity and nothing else.
Wow,
Just need to reassure.
Yeah, I mean, do they also doing trials do they have anything like that for ears and for hearing? Do they ever do any kind of trials, or do they feel they've found now as far as they can go in terms of how to help people?
In terms of tinnitus and hyperacusis, there is still a lot of difficulty because the pathway and of the hearing system, particularly in the upper part within the brain, is still not clear and difficult to assess. So there is no effective way of identifying it. We know about hyperacusis because the patient tells us.
Right.
But although we try to identify some markers, some objective evidence, for example, we do loudness, discomfort levels, and we also we had a little project to identify what changes within the brain in hyperacusis because of the lack of adaptation. So we have some result, but again, it's difficult to apply years before we have something. At the moment, for tinnitus and hyperacusis, because there are different causes, different underlying mechanisms, very difficult to find effective universal treatment, and there is no magic treatment, no magic pill.
So I guess, I think you touched on it before, that some people, if they really do struggle with all this, is that people can go into depression, and obviously they can get anxiety because of the CBT.
Yes.
Do you advise people to try CBT?
I think talking about this psychological aspect of tinnitus, there are two things we need to know. It's not only tinnitus which leads to increased anxiety and depression, but actually there is a personality of the person. Some people are more sensitive than others, and those people who are more sensitive, they are more likely to be affected by tinnitus. So we have different types, because again, depends how our brain is set. We have wide range for somebody who is usually can be very sensitive to noise. I know my husband, he is very sensitive, he doesn't tolerate any noise, but some people don't mind. We have at home triple glazing windows, but some people wouldn't have it. So we have so wide range of normal. So we have very sensitive people with very sensitive hearing and those with less sensitive. So this wide range of normal. But those people who are more sensitive are more likely to be affected by damage, by injury to the hearing system, because they have predisposition to have more difficulty. And so we always try to be very careful in associating anxiety, depression with tinnitus, because some people don't like to say, you have tinnitus because you are anxious. But this is what we know, it's part of the presentation of tinnitus. Even the toughest people have often problem with tinnitus and depression because it's just annoyance. So we have to identify, when we see patient first, we identify, is this person will be enough for simple explanation from the hearing therapist, from me or hearing therapist, just explain about mechanism, explain about different aspects of tinnitus. Some people are happy with that. But in very rare cases, we have individuals with severe anxiety and depression, and we need to seek advice by clinical psychologists who then apply different formal techniques, which in cognitive behavior therapy is one of the options. So it is not something which is unusual. This is multidisciplinary approach to treatment of tinnitus. This is part of it, tinnitus management, and nothing to do with mental state of the person, just part of the problem. Some people need more, some people need less.
Questions. We've asked how often do people present here with hearing problems before or after brain tumour treatment or brain injury treatment?
I think brain injury or brain tumour itself depends where the problem is. If a tumour is on the hearing nerve, this is very common. So I would say, according to our statistics, the tinnitus and hearing loss is associated with a high prevalence in people with this tumour of the nerve, which is called acoustic neuroma. But tinnitus can be sometimes first symptoms of acoustic neuroma. That's why we those people who present with only one-sided tinnitus, we do MRI scan to make sure that there is no, and this is part of the assessment of tinnitus to rule out any significant underlying abnormality. So it is very common. It is definitely there is some degree hearing loss and tinnitus in patients with acoustic neuroma. After the surgery, if they have surgery, they may lose completely hearing, and that often increases tinnitus. So that is quite common. But in other parts of the brain, high level of the brain, the direct injury to the nerve of hearing is much rare. It's not very common. But it may more affect subtle mechanisms which control the hearing system, which may lead to tinnitus and hyperacusis, but without hearing loss, without clinical hearing loss. So I would say brain tumor above the nerve, probably 1 or 2% we see in our clinic, but acoustic neuroma is probably about something between 4 and 8%.
And other people have said it's certain pitches of certain noises that they don't hear a certain wavelength of noise.
Yes. Again, high-pitched sounds, because we have wide spectrum of sounds from the low to high-pitch, like an instrument. The inner ear is like an instrument from the low to high-pitch. So any part of the hearing system can be affected. Most commonly is high-frequency, high-pitched sound, because they are exposed to different environmental effects like noise, toxic medications, or any toxic agents in the environment. So the first affected are high-frequency cells. So people may not be able to hear, especially, for example, some birds or women's voice, because they are high-pitched. And so they have more likely preserved lower frequency, and sometimes they're actually even not aware there is a problem with high-pitched sounds, because if there is long-standing and slowly developing. And sometimes we have patients in the clinic coming with tinnitus, and they're not aware they have hearing loss, but then we can identify it when we do the hearing test. So there is this possibility, and again, it can be associated with tinnitus, high frequency, hearing loss, high-pitched tinnitus.
Another one a lot of people have said is they are incredibly sensitive to storms and like thunder.
That is loudness, yes. Loudness can be, we call it loudness discomfort. That may be different than hyperacusis. Hyperacusis is a term which is referred to the people who have normal, clinically normal hearing thresholds, and this is because of the lack of the inhibition from the brain, and then there is increased gain in the hearing system. But the loudness discomfort can be also present in individuals who have damage to the hearing cells, because part of the inner ear has hearing cells which protect from loud noise, and if they are damaged, that person may not be able to hear soft sound, but when sound is increased to louder levels, that may affect much greater than individuals with normal hearing, and we call it loudness recruitment or loudness discomfort. But this is associated with specific hearing cells of the inner ear damage. So they are sensitive to loud noise, but hyperacusis we have sensitive to normal environmental sound, to even quiet sounds.
Right. And then a big thing for like you and lots of people is if you've got more than two people in a room talking, or you go into a room and there's conversations going on, they can't focus.
I think we have commonly in our clinic people coming with difficulty hearing. They said we have no problem with talking to you one-to-one, but if I go to the pub, go to the party, or simply in the street with noise, I just cannot hear. So again, if we could do the test, we can find subtle damage to the hearing system, for example, high-pitched hearing loss. And this can cause difficult hearing because we don't have entire spectrum. So when people talk, every word has sound of different pitch. So if you have no high-pitched sound representing that word, the person may not hear well this particular word. But we may also have entirely normal hearing in people who have difficulty, again because this listening in noise requires ability of the brain to focus sound, and this depends on the high centers, again of this descending system. So in what we commonly see in patients with hyperacusis, they get very sensitive to noise, but at the same time when they go to noisy place they cannot hear properly, because the mechanism which is responsible for hyperacusis, because lack of suppression can increase activity in the brain. At the same time, lack of this mechanism prevents the person to listen, because we need suppression for listening, because when we are listening sound, we have to be able to amplify the sound of interest and to suppress the surrounding sound. So this component of suppression is missing there. So we can hear all amplified and very uncomfortable. Some people can even get dizzy because of the sound and disorientated, but not able to focus. The same like in vision. You have difficulty with it. We have to sometimes focus, ability to focus, like a radio tuning. This means lack of that ability can also cause this difficulty listening.
Thank you so much for talking to us.
Not at all, pleasure.
And, I really think this will benefit other people. And but thank you
No, pleasure.
to everyone on Croydon Radio.